A recent evaluation by TOPO has found that by integrating employment support services into general practices, it is possible to support people with mental health issues to return to employment and stay in jobs. 2.9 million people in New Zealand are of working age. Each year, 1 in 5 will experience a mental health issue, such as depression, anxiety, or schizophrenia. That's 600,000 New Zealanders. Of these people, approximately 400,000 will be in employment and 200,000 will be out of employment. For the people who are working, many of them will need support to stay in their job. At the moment, the right support isn't available, which means people with mental health issues risk falling out of work at twice the rate than people with other health conditions. Of the 200,000 people who aren't working, many would like to get a job but need support to do so. When people seek help for symptoms of mental ill health or are out of work and need a medical certificate to apply for welfare benefits, their first point of call is often to their health professional, usually a GP. A wealth of research shows it is best to offer employment support as part of healthcare services to enable people with mental health issues to return to or stay at work. TOPO's recent evaluation has found that by applying this evidence and placing employment consultants into general practices, people with mental health issues can be supported to stay at work or return to employment. The service is valued by GPs and provides an evidence-based intervention as an alternative to signing people off from work.
We used to think that people had to get better first before they could even think about or return to competitive employment. We also used to think that people with complex or what's called severe and enduring mental health conditions would never be able to hold down a competitive job. And we know those things are both untrue. And research over the last 20 years has been very clear on those two things, and they're still often myths that people hold on to, but we're absolutely clear that those things don't have to be the case. Many people with mental health conditions do want to return to work. They see it as a very important part of being a citizen, as everyone does. If someone is off for a longer period of time, say for example 4 weeks or more, that's a really important time to be thinking what do we need to put in place to support this person. It's very likely they will need individual independent case management, and that person can provide guidance advice in line with the person's wishes to coordinate the care between the GP, the health professional and the workplace, and actually get that coordination of support to get that person returned to work.
So when patients are coming in, I'll just mention that there's now a free service called WorkWise that's dedicated towards getting people back into some form of employment, and it's free. It involves them having an interview with Megan, who they can either come across here to see her, or Megan also comes to the surgery. And often, patients are pretty happy. Really, it gives them an out, so they've got a chance of doing something, getting back into employment. So from my perspective, I sort of work in a low socioeconomic area, so a lot of mild to moderate mental health problems. So for me, I've got a lot of patients that have been on a sickness benefit or out of work for quite a long time, and so it's basically another team of people there sitting, trying to get these people back into employment, which is better for them, better for the country, better for everybody really. Yeah.
The employment consultants visited there 5 days a week. We spent about half a day there each day, and got to know the team, morning tea, met the doctors, chatted to everybody we could when we could, to be very mindful of not treading on toes or taking up too much time, and we've had some really great results. I worked with one guy who he was early 50s, and he'd only had two jobs in all his working life, and he'd been in a situation where he'd been bullied in his last job, and he became quite unwell and ended up resigning, and went off to see his GP, and the employment consultants just happened to be on board at that point, and so he was referred to one of the consultants quite quickly. We got working with him, and within about a month he had another job, and we supported him for maybe a couple of months after that, and away he went.
The types of services we've been talking about are not routinely available, although they're effective. It's actually helping someone think through the rest of their lives, and we know from the research evidence for a number of conditions, not just mental health conditions, that healthcare treatment alone is not a good support for adults of working age to get back to work. So we need to combine it with good employment support, which is looking at individual aspirations, skills and job matching to the workplace, and providing ongoing support in the workplace if that's needed as well.
Delivering employment support as part of general practice is a key part of helping more New Zealanders with mental health issues return to or stay in employment. Visit tapo.co.nz/EBSE to find out more.